So I'm in my med room right now. I just came in. I'm coming in to work with a patient named Jonah Dinerman, and we are going to be helping him with his medication. So I have all my supplies right here that I need. I have my medicine. I have my little cup that he's going to need to take it. So I have my supplies. I'm logged in. So now I'm just going to wash my hands really quick, and I'm going to put my gloves on. Okay. Okay, now that I have my gloves on and everything, I'm just going to get my medication out that I need. So I go to Jonah, and I see that this is his name, and I see that he needs atorvastatin. So I go to that, and I make sure that that is the medication that he needs. He needs atorvastatin for high cholesterol, and he needs 20 milligrams. He needs to take it orally, and that he needs to take it at this moment within like a 30-minute range. We want to make sure of that. The expiration is good, needs it for high cholesterol. So I got that. I made sure of that. I'm just going to go into the orders, and I'm going to look for nursing considerations, the action, the purpose of all of this. I'm going to also go in and I'm going to look in the MAR that he has no known allergies to make sure that there's no complications with this medication. And so looks good right here. Okay, so now he needs 20 milligrams, and this is only 10 milligrams, so we're going to be taking 2 in there. This isn't a wrapper, so we're not allowed to take it out until we get to bedside. So I'm just going to set this here. Then I'm going to lock everything up so that we don't get anything confused. So again, I'm just going to make sure that I have these right amount, the name, the dosage, the way he's going to be taking it. We see his name, what he needs to take, atorvastatin for high cholesterol. So we should be good. So now I'm just going to go into his room, Jonah's room. Now we're here into the room. I'm just making sure I have everything that I need for Jonah. I have the right medication, the right way to be taking it. Yes, okay, and now I'm here. I'm just going to wash my hands and put my gloves on. Hi, Jonah. My name is Drew. I'm a student nurse. I'm going to be helping you with some medication that you're going to be taking. And we're going to be taking a medication called atorvastatin, and it's for high cholesterol. And so I'm going to be getting you ready for that. So I'm just going to ask you for your name and your date of birth. And perfect, okay. And so then I'm just going to scan your bracelet to make sure that is working. It's in there, perfect. Okay, and I'm going to ask if you have any allergies to medications, anything that we should know about, if you're able to swallow a pill orally. Okay, perfect. Okay, so now I'm going to scan the medication. Okay, let me get this. Okay, so now we have okay, let's see, scan person, okay, and I just need to scan the medication. Okay, perfect. Okay, so now we're in to the medication, and I'm going to make sure that we have the right dose. So it says 20 milligrams. So we need 2 of these pills. because this is only 10 milligrams. So I'm going to just open these up, put them in this cup. So the right dose, you see this is for Jonah. We need the right route, and this is orally, and the time is now 13:31. So we're going to be giving this to you, Jonah. This is, again, for your high cholesterol. You take this regularly, right? Okay. This is to prevent any heart attack, stroke, anything that we can help with that with people with cardiovascular disease. And it's important that you continue a good diet and good exercise upon taking this medication, no alcohol. And there might be some side effects like GI upset, muscle aches, anything like that, and we want you to let us know if you might be feeling that way. And we'll be checking on you to make sure that this medication is right, checking cholesterol levels. And sometimes when we give medication, we do have to check vitals and everything, and your vitals looked good. And so that should be good. And we're just going to be taking this now. We're going to put you up in the right position so that you can swallow. Just want to make sure that you can swallow, right? Okay, perfect. Now, I'm just going to help you take this and take some water. Okay, perfect. Okay, so now you took this medication. If you have any questions, you can ask any of us. You can ask us. We'll be watching you to make sure that everything is going well. So if you don't have any more questions, just get you comfortable, put the bed in the right position. I'm just going to take off my gloves and wash my hands. Okay, and then I'm just going to go down here, and I've done my 3 checks. Going to make sure the ID check, and then I'm going to say that it was administered. Okay, well, if you don't have any more questions and if you don't need anything, then we'll be back in just a little bit to check on you, liver problems, cholesterol, everything. And yeah, okay, we're all done.